This is a summary video describing the principles of neuroplastic surgery and surgical aspects of cranioplasty reconstruction. What you see here is a large right-sided hemicraniectomy defect with a major portion of the cranial skeleton missing. This is time of presentation for secondary cranioplasty with sunken scalp flap. First, the scalp is injected with diluted epinephrine, followed by needlepoint electric cautery and dissection through the previous scar. At this point, under loop magnification, the needlepoint electric cautery is used to dissect the stable scalp away from the skull defect. At this point, we start the pericranial onlay dissection in the subgaleal plane along the loose areolar tissue. As the flap is elevated, we're careful to keep the galea aponeurosis intact above to protect the subdermal plexus. The vascularized pericranium is left intact, protecting the epidural space. At this point, the flap is mobilized anteriorly based on the superficial temporal artery system. The flap is brand new and consists only of galea, fascia, and skin. This is the point in which tack-up sutures using 4 Neurolon are placed within the vascularized pericranial onlay flap. This is the virtual design plan of the large hemicraniectomy reconstruction with customized cranial implant using clear polymethyl methacrylate. On the host bone model, one can see the size and shape of the implant following on-table modification in order to make sure there's a smooth transition at the borders. A wire passing drill bit is used to place drill holes, and the pre-plating is performed on the back table. At this point, we pass the tack-up sutures through the cranial implant, and using 4mm screws and low-profile plates, the implant is inset. Fine on-table adjustment is made using a high-speed drill. The cranial reconstruction with customized implant allows for a symmetrical result as seen here on bird's eye view with 3-layer closure and tension-free approximation of the scalp. 3D reconstruction of the skull demonstrates a good symmetrical reconstruction.